cancer centers in Quebec are reporting a significant decline in screening appointments over the past year. That's sparking concern from specialists who are now warning delays in spotting cancer could lead to another health crisis in the province. They're calling for a targeted program to help speed up screening and to potentially save lives. Leah Hendry is reporting from Montreal today.
At Montreal's Cedars Cancer Centre, there were 20% fewer cancer diagnoses in 2020 compared to the previous year. Some people may have put off seeking medical attention because they were afraid of getting COVID-19. Others may have faced delays in getting routine screening, referrals, or biopsies. But those missed cases will start showing up.
There's going to be a fair proportion in whom those cancers are going to be more difficult to manage.
Since the fall, Aprikian says his team already believes they're seeing patients with more complex or advanced stage cancers. These cases often require multiple treatments or more difficult surgeries.
The economics on the health system in managing these extra treatments for patients who otherwise would have perhaps been cured, all of this is going to be additive.
During the first wave of the pandemic, mammograms were postponed until June. According to the Ministry of Health, about 91,000 fewer mammograms were done between April and December 2020 compared to the previous year. Colorectal cancer screening, typically prescribed by a doctor to look for blood in the stool, went down by 74% last spring. If the test is positive, the next step is a colonoscopy, which can detect abnormalities, but those dropped by 66%.
We see an impending disaster. We see a crisis that will have all the makings of the crisis in the long-term care facilities.
Once you start diagnosing more cancers, there needs to be room to do chemotherapy and surgery. But Baptiste says it still hasn't recovered from the delays that piled up during the first wave of the virus. Specialists and advocates agree a targeted provincial cancer care plan is needed.
We have to plan for the future, not just be reactive, we have to be proactive.
For Stein, that means shifting some services away from hospitals.
People with early stage cancer who are, let's say, cured, just being followed up and, are low risk from recurrence, can be transferred back to the community.
General practitioners could monitor the patient, and specialized clinics could be set up for follow-up blood tests, mammograms, or colonoscopies. This way, Stein says some screening and diagnostic procedures would be protected in the event of a future pandemic. Leah Hendry, CBC News, Montreal.